Here is the room. So my name is Cheyenne Navarro, SHIANENAVARRO. Today I'm going to be doing a head-to-toe assessment. This is my patient. I'm going to start by closing the curtain for patient privacy, washing my hands, and wiping my stethoscope down. Do you have any questions before we begin?
No.
Do you have to empty your bladder?
Mm-mm.
Okay, so can I start by having you tell me your age, where we are, who I am, and what time it is?
I'm 14 years old. We're in a clinic. You're my nurse, and it's around 9 o'clock at night.
Okay, so my patient appears to be alert and oriented. She looks the age that was stated. Her color is even throughout her whole body. She appears nourished. Her posture is appropriate to her age. There's no excess curvature. Her body appears to be symmetrical, and she appears to have good hygiene. There is no physical deformities that are obvious. She's maintaining eye contact. Her mood is appropriate to this assessment. She is dressed appropriately to the environment. Next, I can see that there is no obvious effort in breathing. I'm going to assess your gait now, so can I have you walk forward and then walk back? So the gait was normal. There was no swaying to the sides while she was walking, and her arms were swinging both as she was walking. Next, I'm going to inspect and palpate the head. So there was no deformities, there was no lumps, there was no lesions, and there was no masses. The hair is evenly distributed throughout the head, and there's no infestations. Next, I'm going to inspect and palpate the face. So the face, the color is even all throughout. It appears symmetrical. There is no scars, and there is no obvious masses. Moving on to palpating the face. Again, no masses, temperature is even throughout, no scarring, and no edema. Next, I'm going to test cranial nerve number 7. So can I ask you to raise your eyebrows? Can I ask you to shut your eyes tight, frown, smile, show your teeth, and puff out your cheeks? Okay, so all actions were done symmetrically. There appears to be no abnormalities with cranial nerve number 7, telling me that it is intact. Next, I'm going to move on to the ears. Upon inspecting the ears, there appears to be no discharge, and they are symmetrical to the head. Now I'm going to palpate the auricle and the tragus for tenderness. And there was no tenderness present. Next, I'm going to perform a whisper test. So I'm going to get you to cover one side of your ear, and I'm going to whisper 3 words, and you're going to repeat them back to me, okay?
Sun, cloud, rain.
And we're going to do the same thing on the other side.
Hat, cat, dog.
So the patient was able to successfully repeat all 3 words back to me on each side of the ear. Next, I'm going to move on to the eyes. Both eyes are symmetrical. Her sclera is white. There is no lid lag. Can I ask you to look up? Inspecting the conjunctiva, there is no discharge, and the conjunctiva appears pink in color. Both pupils are symmetrical. Both are round. So now I'm going to put one light into one eye, and I'm going to assess the reaction. So the pupil was able to constrict. Meanwhile, the opposite eye's pupil was consensually constricted in the other eye. Once again, the pupil constricted and the other eye consensually constricted. Next, I'm going to ask you to focus on the object here. And now focus on my finger. So while the patient focused on the object in the distance, the pupils were dilated. And when the patient focused on an object close by, both pupils consensually constricted and the eyes converged. Next, I'm going to inspect and palpate the nose and sinuses. So the nose is midline to the face. There appears to be no discharge. And I'm going to palpate the frontal sinus and the maxillary sinus. Was there any pain? No, just mild tenderness. Yep. Next, I'm going to move on to the mouth. So the lips appear symmetrical and hydrated. Can you show me your teeth? All teeth seem to be accounted for and there's no abnormal positioning. Can you show me your gums? There's no bleeding or swelling in the gums. And your tongue? Tongue appears pink with no lesions. Next, I'm going to test cranial nerve number 10, the vagus nerve. I'm going to ask you to stick your tongue out and say ah, okay? Go. So the uvula does not appear to be deviated, and the soft palate rose when the patient said ah, letting me know that cranial nerve number 10 is intact. Next, I'm going to test for cranial nerve number 9. So I'm going to insert my tongue depressor and assess the gag reflex, okay? So the gag reflex was present, letting me know that cranial nerve number 9 is intact as well. Next, I'm going to test for cranial nerve number 12. I'm going to ask you to say light, tight, and dynamite.
Light, tight, dynamite.
Okay, so the patient's tongue was able to move from side to side, and there was no tremors, letting me know again that cranial nerve number 12 is intact and there is no abnormalities with that. Moving on, I'm going to inspect and palpate the neck. So there does not seem to be any masses, scars, lesions, or any abnormal or obvious enlargement of the thyroid. Next, I'm going to palpate each side of the carotid artery. So I'm going to give the pulse quality a 2+. My findings are normal. Both sides are very strong, equal, and regular. Next, I'm going to test for cranial nerve number 11, a spinal accessory nerve. So I'm going to place my hand on the side of your face and I'm going to ask you to turn your face into my hand with resistance applied. Okay, and then the other side. And now with the shoulders. Okay, perfect. She was able to complete all tasks asked, indicating that cranial nerve number 11 is intact. Next, moving on to the upper extremities. Upon inspection, there seems to be no scars, no joint inflammation, no obvious movements, and no discoloration. Now I'm going to palpate the upper extremities. There is no excess moisture. There is no edema. The temperature is warm all throughout, and there was no masses present. Next, I'm going to test her range of motion. So can I ask you to flex your fingers? Can I ask you to extend your fingers? Can you flex your wrist? Extend your wrist? Show me an ulnar deviation, a radial deviation. Can you flex your elbows? Extend your elbows. Show me supination and show me pronation. Great. Can you shrug your shoulders? Abduction, adduction, external rotation, internal rotation. So the patient was able to complete all tasks asked. There was no there was no altered range of motion present. Next, I'm going to inspect her nails. There's no lesion in the nails. And the cap refill is 2 seconds within normal range. Next, I'm going to inspect the lower extremities. So they appear to be even and colored. There is no joint inflammation. There is no lesions or masses present. Next, I'm going to palpate the lower extremities. There was no pain, there was no tenderness, there was no swelling, and there was no masses present. Next, I'm going to simultaneously palpate the radial pulse. Just here. Okay, so I got about 65 beats per minute. Both radial pulses, I would give the quality a 2+ as well. Both were regular and very strong. Next, I'm going to palpate the dorsalis pedis pulse. Can I just get you to sit back with your foot on the bed? Okay, which is just on the top of the foot here. I'll just do them simultaneously. Both appear strong, again a 2+ within normal range. Next, I'm going to palpate the posterior tibialis pulse, just below and behind the ankle. And the other side. Again, both appear to be normal, a 2+ rating, and they were both strong and regular. Next, I'm going to test the dorsiflexion. So I'm going to hold the ankle and apply resistance while you flex the foot. Good. And just on the other side. Good. And then next I'm going to assess plantar flexion. So I'm going to ask you to stand on one foot, on the ball of your foot, and I'm going to ask you to up and down 5 times. And the other foot. I'll just show it. Can you just do one more time? Okay, perfect. So I'm going to give the patient a grading of 5 as she was able to complete 4 to 5 flexes on each foot. Next, I'm going to inspect her posterior thorax. Can you just have a seat on the chair? Just sideways, actually. Okay, the color is even throughout. Upon inspection, there is no skeletal deformities, there is no scars, and there are no lesions. Now I'm going to palpate the posterior thorax. It's warm to touch throughout. There's no excess moisture. There's no skeletal deformities. There's no muscle atrophy or anything apparent. Next, I'm going to listen for breath sounds. Okay, I'm going to ask you to breathe in and out. Once again, in and out. Again. Again. Okay, so the sounds that were present were vesicular and bronchovesicular breath sounds that are all within normal range. Now I'm going to auscultate the anterior thorax, and I'm going to indicate where each of the correct valves are in their locations. So on the right side, we have the aortic area. And just to the left, we have the pulmonic area. And below that is Erb's point. Then we have the tricuspid area. And then at the 5th intercostal space, we have the mitral area. also known as the apex of the heart. Okay, so I'm going to give her a 2+ quality for her pulse. Also, there was 63 beats per minute. It's strong, it's regular. Her anterior posterior to transverse ratio is a 1:2. S1 and S2 sounds are both best heard over the apex, also the mitral area in the fifth intercostal space. So next I'm going to move on to the abdomen. So I'm going to ask the patient to lay on the bed. I'm going to drape the patient. Okay. Upon inspecting the abdomen, there appears to be no discoloration. The abdomen appears symmetrical. There is no obvious superficial masses, and there is no lesions present. Are you comfortable? Yep. Next, I'm going to auscultate all 4 quadrants of the abdomen. I'm going to start with the left lower quadrant and the left upper quadrant, and then the right upper quadrant and the the right lower quadrant. Okay, there was gurgling present in all 4 quadrants. There was about 10 to 30 bowel sounds present a minute. Next, I'm going to lightly palpate the abdomen, starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. There is no superficial masses and no tenderness present. And lastly, I'm going to palpate the bladder. Was there any discomfort? No, and there was no tenderness present. We are finished our head to toe assessment. And that completes everything. Thanks.